Since my early age, I've always enjoyed helping people. My aunt used to pick me up all the time every weekend so that I could help her with her kids. And as I grew, I always said I wanted to be a nurse, I wanted to be a doctor. And when I seen the opportunity of becoming a home health aide, I took it, I didn't let it go. I took the training and I did that for many years. I enjoy helping those that need help.
The home care workforce has doubled in the last 10 years. As baby boomers age, as how we age and how we take care of each other have changed, there are going to be more people who need care in home and community-based environments.
The most I have learned from my clients, what they like is someone should just be there and listen, accompany them, especially if there's a member that doesn't have anybody. It's my first client I've had. They didn't have any family support. I was with her for nearly 3 years before she passed away. I was the only one there providing for her and being her backbone. Even though she's passed more than 15 years ago, I have her in my mind and my heart every day. I feel like I lost someone from my family.
Turnover in the industry is very high. It's between 40 and 60% nationally. People don't want to stay in these jobs because it's very physically and emotionally demanding work, and yet it's not compensated as highly even as, a janitor or a retail salesperson or a fast food worker in many cases.
I live check by check to pay the rent, whatever my kids needs, pay my bills, buy food, take a little bit out for everything. It's been really hard. I have considered continuing my education as a CNA. The training in becoming a CNA takes 9 months to a year, between 6 to 9 every day of the week. That has been very hard for me because of my youngest daughter, being that I'm a single parent.
The current landscape for the home care workforce is not sustainable. If we don't raise wages, if we don't change the working conditions and better value this workforce, we're not going to have individuals to fill these jobs. We have to allow low-wage jobs to still be living jobs and allow the next step up to be more realistic to raise a family, give someone income to raise a family, even if they're in an entry-level or a low-wage occupation. It's all about investment. If employers can see that it is valuable to invest in a worker's education so they can have a greater level of skill, we have to have buy-in from the payers, the managed care organizations, the employers. We have to invest in their workforce and I'll give them opportunities to go to school. If it is Marisol, maybe they could do some course load during the workday, or they could reduce cost of tuition because the employer is helping to subsidize their education. That's the employer investing time or money in their workers' success, and they're going to see that result once that person has a greater set of skills.
My short-term goal is to become a CNA, and long-term goal is to eventually go back to school and become an RN. And in the past, I didn't think I was able to do certain things, but now that I go visit several members and I'm able to help them in different ways, different fields, it's giving me the confidence in knowing that I'm able to do more. At the end of the day, seeing them happy makes me proud of the work that I did.